What do radiologists look for in mammogram images? When you think about a mammogram, imagine it as a detailed map of breast tissue that helps doctors spot early signs of problems. Radiologists are the experts who carefully examine these images to find clues about breast health. Their goal is to identify anything unusual that could be a sign of breast cancer or other benign conditions. They follow strict guidelines to ensure they catch potential issues early, which is key for effective treatment and better outcomes. First, radiologists look for masses or lumps in the breast tissue. These can be any size or shape, but suspicious ones often have irregular, jagged edges or look different from the surrounding tissue. Benign lumps tend to have smooth, well-defined borders, making them easier to distinguish. Next, they check for calcifications, which are tiny calcium deposits visible on the mammogram. They differentiate between benign calcifications, which are usually larger and scattered, and microcalcifications that are small, clustered, and sometimes a sign of early cancer. Another important feature is architectural distortion. This means the normal structure of the breast tissue appears abnormal or pulled in, even if no distinct mass is visible. This can be a subtle sign of cancer or previous surgery. Radiologists also compare both breasts to look for asymmetry, where one breast shows areas of increased density or tissue pattern differences that could suggest an abnormality. Breast density is another key factor. Dense breasts have more fibrous and glandular tissue compared to fatty tissue. High breast density can make it harder to see cancer clearly and is also considered a risk factor for developing breast cancer. Radiologists categorize breast density to help guide screening decisions. They also note other findings like enlarged lymph nodes, cysts, or implants, which can sometimes be relevant to overall breast health. To standardize their reports, radiologists use the BI-RADS system, which classifies findings from 0 to 6. A category 0 means the images are incomplete and need more tests, while a 6 indicates a confirmed cancer diagnosis from a biopsy. This system helps doctors decide on the next steps, whether it's additional imaging, biopsy, or routine screening. In screening mammograms, radiologists aim to be highly sensitive to catch as many potential cancers as possible, but they also work to avoid false alarms. Their experience helps them distinguish between benign and suspicious findings, reducing unnecessary biopsies or follow-up tests. Because early detection is crucial in managing breast cancer, radiologists play a vital role in identifying subtle signs that might otherwise go unnoticed. In summary, radiologists look for masses, calcifications, architectural distortions, asymmetries, and patterns related to breast density. They use standardized tools like BI-RADS to evaluate the risk and guide further action. This careful, detailed review supports prevention and early detection efforts, helping women receive timely care and improving their chances for successful treatment. Always remember to discuss your mammogram results with your healthcare provider for personalized advice and follow-up.